Welcome to this special edition of the ACC Update. I'm Patrick Hope. Nearly 400 cardiovascular professionals are in Washington, D.C. this week for the American College of Cardiology's 2012 Legislative Conference. Healthcare policymakers, members of Congress, and key congressional staff will be addressing hot topics like health reform implementation, practice trends, payment innovation, and the upcoming elections. In addition, participants will head to Capitol Hill to meet face-to-face with their congressional delegations. Joining me today is Dr. Jerry Kennett, Chair of the ACC Advocacy Steering Committee. Jerry, thanks for joining us.
Thanks, Patrick. It's good to be here today.
What are the biggest highlights of the 2012 Legislative Conference?
This is our 21st Legislative Conference, so it's been a very successful endeavor for many years. But some of the really great things this year are the fact that last evening we had a fantastic talk by George Will. He talked about the political environment we're in, but also talked about just the U.S. Congress, the budget, the country. Had an unbelievable number of quotes that you'd like to take back home and use. It's our 10th anniversary this year of the ACC PAC, and we're one of the 10th largest PACs in the country now, so that's a highlight. But the big thing is we have the opportunity to go up to the Hill, take our message to the Hill. We got to hear this morning from several legislator assistants, and so we got a lot of information from them about how they view the ACC, which in general is extremely positive. So it's a very successful event.
What would you say are the key messages that we're going to deliver to Capitol Hill tomorrow?
The key message is this. The American College of Cardiology and our members want to work with Congress to improve the healthcare delivery across the United States, to improve outcomes, and to lower cost. We've been very successful, the ACC has, in the past many years, in measures such as appropriate use, our focus program, and others to help lower cost. In that environment, our message to Congress is we need a stable payment platform for our physician members to be able to practice in until we can actually move to the next step in payment reform. So that includes the issue of sequestration, so that we don't hopefully implement sequestration which will hurt not only physician payment, but even more so it's going to hurt research, the NIH and others out there, graduate medical education reimbursement. So sequestration is a big issue. The sustainable growth rate is another part of our message that has the potential to reduce reimbursement by 27%. So we need a stable platform, including no further cuts on imaging, because actually the ACC has been able to demonstrate that our measures have reduced imaging costs over the past few years.
We have a record number of fellows in training, cardiovascular care associates, and practice administrators attending this year's conference. Talk a little bit about the ways their perspectives help in communicating with members of Congress.
It's a tremendous success this year in terms of that group of individuals, because our cardiovascular care associates and the practice administrators demonstrate the teamwork approach that the ACC has been engaged in for years, and we're one of the leaders in that field. Having the young fellows in training go up to the Hill, even this morning in one of our sessions, Congress, acknowledged that having people who are going to be the future of medicine coming up and bringing that message is going to be key to them receiving it in a positive fashion.
Switching gears a bit, results from the ACC's 2012 Practice Census we released at the conference. The results showed a continued trend towards hospital integration and highlighted the very real concerns associated with continued Medicare cuts and reimbursement in general. What is your advice to ACC members in regards to these results?
The ACC remains very concerned about the survivability of private practice for cardiologists across the country. We've testified, before the Small Business Committee on private practice and are concerned that the physician payment platform has to be stable to maintain private practice. We're going to continue those very efforts because we do want to make it clear that some of the disparities in payment that exist between different locations and of the same service don't seem to be able to improve access to care and don't seem to be lowering cost of care, which we think is just the opposite of the way we want to go. So the ACC is very involved in efforts to try to maintain the private practice of cardiology across the United States.
Thank you, Dr. Kennett, for being here today.
Thank you, Patrick.
The ACC's Legislative Conference is an important opportunity for the cardiovascular community to unite as one voice and educate members of Congress about the impacts of their health policy decisions on cardiovascular care. For many participants, the conference is a way to continue to foster relationships with representatives and senators. For those attending for the first time, it's an opportunity to learn more about the ACC and begin to build new relationships with colleagues and congressional leaders. More information on the conference, including photo highlights and blog coverage, is available on cardiosource.org/legislative conference. That's all for this edition of the ACC Update. Join us again and stay tuned to CardioSource for All, the news from your college. I'm Patrick Hope. Thanks for watching.